Well, it's time for our health report. Joining us now is Africa 54 health correspondent Linord Moudou with an update on the Ebola outbreak in West Africa. Hello, Linord.
Hello, Vincent. The World Health Organization says the death toll from the Ebola outbreak in Guinea, Liberia, and Sierra Leone has hit 337 since February. The WHO says 47 new cases and 14 deaths have been reported in the region in the last week alone, despite the dispatch of international experts to help out. Guinea remains the worst affected nation, with 264 Ebola-related deaths, but the toll in Sierra Leone and Liberia has recently spiked, with 49 and 24 deaths, respectively. Today is World Sickle Cell Day. It's a day to raise awareness about the disease that affects millions of children every year and significantly reduces their quality of life. People with the disease have 2 copies of the sickle globin gene, which produces an abnormal hemoglobin and red blood cells. Sickle cells are stiff and sticky. They tend to block blood flow in the blood vessels of the limbs and organs. This can cause pain and organ damage. It can also raise the risk for infection. Sickle cell anemia affects millions worldwide and is particularly common among people of African descent. A mosquito-borne virus that causes intense joint pain is rapidly gaining a foothold in many parts of the Caribbean, and now it has found its way to the United States. They suffer severe headaches, a burning fever, and so much pain in their joints they can barely walk or use their hands. It's like having a terrible flu combined with an abrupt case of arthritis. Hospitals and clinics throughout the Caribbean are seeing thousands of people with the same symptoms.
Headache, fever, body aches. My legs are swollen. I have a severe stomach ache since yesterday.
Marlenice Reyes suffers from Chicungunya, along with other patients here at this hospital in Dominican Republic. The disease originated in Africa years ago and is transmitted by a mosquito. Its name comes from the Kimakonde African language and means to become contorted. While the virus is rarely fatal, it is extremely debilitating.
It gives you fever, headaches, body aches. This pain is ruining me.
Outbreaks of chikungunya have occurred occasionally in Africa and parts of Asia in the past. The disease has spread wider recently. The Pan American Health Organization reports over 160,000 suspected and more than 4,000 confirmed cases in the Caribbean as of mid-June. Climate change and means of transport like ships can help spread the disease-carrying mosquitoes. In the Dominican Republic, authorities are attempting to control mosquitoes from dense urban neighborhoods to beach resorts.
We are spraying these neighborhoods because a few days ago we had suspected cases of chikungunya.
So far, there are no signs the virus is keeping visitors away from the Caribbean. Dan Turkel is an American vacationing in Boca Chica.
I know that mosquitoes carry malaria, also yellow fever, and I'm not aware of this one.
Recently, cases of chikungunya have been confirmed in the U.S., including the southern state of Georgia. Dr. Roger Nassi is chief of the arboviral diseases branch for the Centers for Disease Control and Prevention.
What we're seeing now is an increase in the number of infected travelers coming from the Caribbean, which is expected because there's a lot of U.S. travel, a lot of vacation travel, a lot of work travel between the mainland and the Caribbean island countries where the virus is now spreading.
Once a person becomes infected, there is an incubation period of 3 to 7 days before symptoms appear. There is no cure for chikungunya. The best prevention is to avoid mosquito bites, including with the use of mosquito repellent. And that's our Africa Health Report for today. Back to you, Vincent.
Well, thanks a lot, Linord. Be sure to watch Linord Moudou's health updates every Tuesday and Thursday on Africa 54.